Now, the next part, once you spit out the closest, you are going to start brushing your teeth. And I recommend a toothbrush that is resilient, that is dense, that has a number of good bristles, and a toothpaste that you have seen in the stores for the last 60 years, anyone who has been shopping. And it is very important that it says helps stop cavities before they start. Because this Crest, this specific one, is the only formulation of toothpaste that has ever been shown to remineralize teeth. Oh yes, the young generation think you need special remineralizing toothpaste at $25 per time. That toothpaste has, the one, if you're thinking about the nanohydroxyapatite toothpaste, that toothpaste has never yet been endorsed by the European Safety Commission. And there is a concern about absorption of nanoparticles, but also that it might form a layer on the outside of your enamel, unlike the way teeth naturally mineralize. So I am going to endorse this toothpaste, which costs $1.95, $2 a tube. This tube should last you for about 6 months. So don't tell me you're on a budget, because you can use this. If you are allergic to SLS in other toothpastes, I would advise you to try this one, because those other toothpastes have ingredients that are messed up most of the time, releasing SLS that will cause some of these ulcerations and irritations that people experience. I have never, in all my 50 years of being a dentist, had anyone have a problem when they use this specific formulation of Crest. Not the Pro Health, it has a different ingredient list. And if you're doing a backward flip because I have fluoride in this toothpaste, I have addressed that, and I will address that in other videos. Basically, I endorse one compound of fluoride, apart from the naturally occurring fluorides, which are different compounds. And if you're going to drink tea, you're drinking fluoride. I am not suggesting drinking fluoride. I don't endorse supplements. I don't want it added to my drinking water. I would like it taken out, and have tried to do that here in Austin, Texas, without success. I'm sorry. I tried really hard. But that's a different story. The story I'm talking about is topical application of fluoride to the outside surface of your teeth. You are going to wash this away almost within 30 seconds to a minute of putting it in your mouth. I will be suggesting a fluoride rinse as the ending to the complete mouth care system as well. And I will say that it has to be put in perspective. The topic of fluoride is complicated. I have a 20-minute video at my oral health boot camp about the topic of fluoride. I take it very seriously, and if you watch that video, you'll know I gave supplements to some older children of mine and damaged their teeth in the process of giving it to them to consume. I would never suggest fluoride supplements, strong fluoride gels at the dentist. I'm not saying that. I am suggesting one kind of fluoride, sodium fluoride, at a very small dilute concentration, and it will be applied topically. If you use this system, you will spend 5 minutes twice a day using some fluoride in some of the products. That would leave you 1,430 other minutes a day where you will not be using fluoride. It's such a small percentage of your day that you will have this in your mouth. I want you to see it in perspective. It's not even 5 minutes. It's more like 2 minutes, actually. And the rest of the day, you are not going to be consuming or using fluoride. And the result is that you will experience oral health, hopefully for your children, pristine teeth like my teenage grandchildren are now experiencing when friends of theirs have fillings, and then when their kids go to college. My kids have come out with no damage, no gum disease, no 15 interproximal cavities when they had braces, nothing. And then as they are maturing, when they've been through pregnancy, no problems. What is that worth? Is that worth a few minutes a day to rinse and spit? Yes, I wish these products were not green and blue. Well, they're green, I guess, green and blue toothpaste. I wish there were some of these ingredients not in these products, but I don't have the luxury of providing you with that. I can only tell you I've used this system myself for 40 plus years. I am confident it is worth that small amount of blue dye in my mouth for 2 minutes. I wish it wasn't there, but I can't help it. And the result is that I don't need plastic sealants in my mouth 24/7. I don't need fillings replaced every 4 to 7 years. I don't need to have my amalgam fillings taken out and replaced. I don't end up with root canals. I don't end up with crowns. I don't end up with retainers. You've got a plastic retainer in your mouth 24/7 or every night of the week. I don't have gum disease. What does gum disease do to the rest of your body? I mean, you got to put this in perspective to put away, and that's the last I'm going to speak about it today, some of these ingredients that you may not like. And I understand that. And I hope that one day I can make you a complete mouth care system with none of the ingredients that we wish were not there. Sorbitol, green dye, and so on. To talk about sorbitol, if you read my book, I do talk that sorbitol is not good. That was to stop you from buying chewing gum and breath mints that are mainly sorbitol. Sorbitol can feed plaque. If you chew up and consume a lot of sorbitol, you can grow plaque in your mouth. You can end up with the symptoms of acid reflux from too much sorbitol. Sorbitol in the mouth rinses to sweeten them. It's a cheap sweetener. It's not ideal. I wish it was xylitol. And I know there are mouthwash options out there, but I only know these I'm going to tell you about today are the ones that work synergistically. They work together. You cannot pick one out and just use closest and get the same effects. You cannot pick one without the other. They are a program. They are a complete system that works together, even though they are a mishmash, bizarre combination of products, and I will credit you that. So we want a nice, relatively resilient toothbrush. Not necessarily, I don't really like electric toothbrushes. Most of the time, soft electric toothbrushes have resulted in people ending up with gum disease and pocketing. I don't see them being that effective. I hear the results of people, oh, I've been using electric toothbrush, and they've ended up with problems. I would recommend, if you're not sure what kind of toothbrush you want, do some experimenting. Try the one I recommend at night when you have time, and try it the way I recommend. And that is to wet your toothbrush, put a small amount, kind of the amount that squeezes out, that would be called the size of a green pea. 2 of those on your toothbrush would be my recommendation. And then with the toothpaste and the moist toothbrush, I'm very much in favor of gum massage. If you have gum pockets, try to know where they are. Get your hygienist to show you whether they're in the front, uppers, lowers. Some people know where they are. Some people have no clue. Try to find out where your pocketing is and aim at that region first when you have the most toothpaste on your toothbrush and you're ready to go. For many people, it's lower molar teeth, the ones at the bottom that have these pockets. Start on the inside, down by the tongue. I will do a video. I'm going to borrow one of my children and do a close-up video of brushing teeth. But basically massage the gums under the teeth below where the roots, where if you could imagine where the teeth go down into the gum, you're massaging alongside the roots of your teeth, and start at the back. It's so difficult to show you like this, and I'm going to try and do it with a real live video, not me doing my teeth, but me brushing one of my kids' teeth, if I can persuade them with enough money to do that. And so go around, go in little circles, and or up and down, whatever it takes to massage the gums on the inside of the teeth and then on the outside of your teeth, making sure you really do get down to the area. I really wish I could show you better, but the area here under the gums, on the gums, not so much on the teeth. Your toothbrush is going to be sideways to your gums like that, going around and around in little circles. You'll have to turn your wrist around to come to the rest of the side that you're holding the toothbrush. When you have done all the lower teeth like that, you may well want to just brush the teeth with some of the toothpaste all around over the teeth. You're not really cleaning the teeth, you're applying good toothpaste to them. If by this time your toothbrush is completely empty, you could wet it again and put a little bit more toothpaste on it to do the same on the upper teeth. I would suggest again, starting on the inside surfaces of these upper teeth, and work around the palate. If you have trouble with your top front teeth, do a good up and down. We don't want to cause ulceration of your gums, but we do want to give them a good massage. And why do we want to do this? We want to massage the gums because that basically is a clarion call to stem cells that are in these pink tissues not far from the gums, from the teeth. And these stem cells will migrate and form new capillary blood vessels to bring nutrients for healing your gums. We want to heal our gums every day. If we do that, they will never become recession. There will be no recession. There will be no loss of attachment. You won't ever suffer gum disease. It isn't an age-related thing. And if you already have pocketing and gum recession, often, I'm not going to say always, because there are other factors, and we get into that in a separate video, but often you can bring those gums back. You can regrow gums back if you will do this kind of toothbrushing. It is not dry brushing. We have moistened the toothbrush, we have applied toothpaste, make it comfortable, don't hurt yourself. And if you have a very small mouth, you may need a youth, Y-O-U-T-H, youth smaller toothbrush to go where you need to go. It doesn't have to be a great big toothbrush. And I did bring a toothbrush that's a very different design. As you can see, this is kind of peculiar backwards yoga type toothbrush. It's called Preserve. It's not as dense, it doesn't have as many fibers, but if you are having trouble getting into the back or getting up on the inside without gagging, you might like a little bit more delicate toothbrush to do some of the brushing. Now, I'm asked about interdental brushes. If you want to use them, this would be the moment. I'm not a big fan of them because I think they can beat down your gums too much. I would much rather see you use one of these mouth watchers, Dr. Plotka's brushes, and get in between your teeth that way by massaging round and round. But if you are wedded to the interdental brushes, do it very, very gently. Do it now at this stage where you have the toothpaste on your teeth. The same thing if you are wedded to the idea of flossing. I am not recommending flossing. I have never needed to. My system is adequate on its own. But if you are determined to floss, make sure your floss is something like this Hello floss without the PFAS toxins in it. And now is the time to floss your teeth while you have toothpaste on your teeth, because you will then drag the toothpaste between your teeth and the toothpaste will have a chance to mineralize your teeth. I also kind of like this radius floss because they are sold in individual packets, and you can keep that for when you now and again feel the need to floss. It shouldn't have to be a regular, always thing. So I'm not a big fan of floss, but if you feel guilty not flossing, or for some reason you really want to, or you've got food stuck, there are some floss materials that you can use. And do it at the toothpaste stage, and that will help you to bring the toothpaste between your teeth, which is an advantage. Now, once you've done that, you can wash your toothbrush off in running water and then stand it up. Make sure that your toothbrush, I love these little donutty things. We have a link to those on the website because you can stand your toothbrushes up. And they're very handy. They come in different colors. I have to use a black one to remind myself that that's the toothbrush I use at night. And then I have a yellow one to remind myself that's the one I use in the morning. Because you want to dry your toothbrush between uses. You want your toothbrush to have 24 hours to dry. That is because when you brush your teeth, you are picking up all the bacteria in your mouth. And they can multiply in the density of these bristles. And you don't want that, because the next time you put your wet, soggy toothbrush back in your mouth, you'll have anaerobic bacteria that can get established in your mouth. If you're a traveler and you put your toothbrush in a bag, a low oxygen bag, and then you're using it at every stop along your way, you may well be developing periodontal disease because of your toothbrush. The answer for that is to take some really cheap ones. Don't worry about what you're buying. Just buy cheap toothbrushes, and during your trip and travels, do the best you can with it and throw it out. When you get home, buy yourself a nice, good, useful toothbrush that's brand new and clean, and let it dry for 24 hours between uses. Electric toothbrushes, again, are very hard to clean because they have hollow insides. These kind of contraptions for cleaning toothbrushes work as well. I just think the individual little donuts are easier because you can give the kids one. You can separate. If your husband's struggling with periodontal disease, you may want to put yours further away, or vice versa. I'm not picking on the guys, but you don't want your toothbrush to be really very close to somebody who's struggling. And with the little donuts, it's more, you can get away from other toothbrushes.